Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I am here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. Are you looking for study sheets? I've created study sheets that cover the content of this episode. If you're interested or that's something that's going to help you on your learning journey, you can click the link listed right in the description of these show notes. Happy studying! I have the pleasure of speaking with Adam Vansickle today. Adam has a really awesome origin story to becoming a dental hygienist. I'm so glad that we connected. Thank goodness for modern technology. And Adam's really here to share some information about Nano-Hydroxyapatite, which I think will be so beneficial for you as students. Right now, you're just learning about all the different products and all the different options for you to become a prevention specialist. And Adam's really going to help you on that journey so that you have one more tool in your toolbox to help other patients help themselves to a better way of managing maybe their caries risk and periodontal risk in their mouth. So Adam, welcome to the podcast. I really love having you here.
Gosh, thanks so much for having me. It's a real pleasure.
I would like you to start first by just telling us how and when you became a hygienist and your journey.
Sure, yeah. So I took a long and winding road to being a dental hygienist. I was a librarian for 15 years before I became a hygienist. I got my master's in library science. I was a research librarian, and I thought that that was my path. And then a turn of events. I had a child and we wanted to be closer to my family. And I started looking for library jobs in the Southwest here. And I just nothing really fit the bill. The pay wasn't as great as I was getting up in Wyoming. And it just made me have to look elsewhere and start to pivot. It checked a lot of those boxes for me, but it also checked the box of being able to work one-on-one with patients. I really enjoyed that component of research librarianship. And then when I got into school, it was like, oh yeah, this is where I want to be. This is so cool. And I've just really enjoyed it ever since. Yeah.
That's really great. I just think there's so much more in common with being a librarian and a hygienist than maybe we think of on the surface.
I think that's true. And I was able, I feel like, to really complement a lot of the studies that I was engaging in school with the background I had. So looking at research, reading research papers, those are all comfortable skill sets for me. And being able to just kind of synthesize that research into a common theme, that all helped, especially when we had projects. Like I had a project in dental hygiene school on nano-hydroxyapatite. And it was a semester long project where I don't know if you guys did table clinics where you're at, but where we, at the end of the semester, we have to basically deliver a presentation to the community, the dental community, on a certain topic. And it's usually a topic that is new and up and coming. And while nano-hydroxyapatite has been around for a long time. Actually, hydroxyapatite has been around since the 70s. NASA actually came up with it, the early formulations of it. But nano particle size has been around since 2003. So it's not new necessarily. There's a lot of research on it, but it's new to the US in terms of the types of products, the preventative oral care products that we have today. Nano-hydroxyapatite is fairly new. And so I was able to do that research on nano-hydroxyapatite in school, and having that research background, I think definitely helped. And I think that's just a component that's still ingrained inside of me. Is I just love doing the research. I'm a real geek when it comes to just, that's what I like to do with my time. Some people like to look at Instagram, and I like to look at PubMed. It's just where I'm at. I don't know.
Oh, well, I love that, Adam. And So you're the perfect person to ask, and this will be good for students to. It'll make them dust off all that stuff they learned about enamel rods and how the whole formation happens and demineralization and remineralization. So, what does nanohydroxyapatite do? How does it work, and what is needed?
That's a great question. Yeah, and we don't, at least when I was in school, we didn't really go over nanohydroxyapatite as part of the curriculum as a preventative oral care mechanism for either for remineralization or for hypersensitivity. And so despite there being a lot of evidence, it's still not part of the curriculum. So I'm excited to talk to you guys about nanohydroxyapatite, how it works, and I'm addressing the students now. You guys will have the opportunity, because there are a lot of patients that are not wanting fluoride. There's just a decreased acceptance when you get out into the regular world uh, um, for fluoride. And so being able to offer them something that's clinically effective and as effective as fluoride, and being able to talk about that and recommend it is really important. So what does nanohydroxyapatite do? First thing it's going to do is it's going to reduce the amount of plaque that's in the mouth. It does that because of its structure. So it has this crystalline six-sided structure, which has a lot of surface area. And so that surface area binds to the proteins on the bacteria. Conveniently enough, it also has a strong affinity for Streptococcus mutans, those acid bugs, and Porphyromonas gingivalis, your periodontal bugs. And so over time, you're going to actually see a reduction in the amount of pathogenic bacteria, and you're going to get a rebalancing of the oral microbiome. So that's the first thing it does. Second thing it does is it smooths in and it fuses in with the enamel. So it's going to coat the outer surface of the enamel, and it makes the teeth actually feel smoother. What it also does by doing that is it creates a shield for future bacteria and staining to adhere to the surface of the teeth. So this is great, not only because it's going to help with whitening. So over time, you're going to get a reduction a brightening effect on the tooth surface, which is a different mechanism of action than you would see in a traditional whitening product like a hydrogen peroxide, where over time, if you're using a hydrogen peroxide material, that's going to, especially if you use it in high concentrations or for long periods of time, it's going to weaken the integrity of the enamel. With nanohydroxyapatite, it's going to actually strengthen the integrity of the enamel. So that's the second thing. It's going to whiten the teeth. It's going to smooth the teeth. It's going to provide that shield. And then the third thing is it provides remineralization to those demineralized areas. So it does that because it is essentially, the body treats it as enamel. It doesn't know the difference. And so there's no inflammatory response when it comes to nanohydroxyapatite. And so it's going to interlock with the enamel rods, and it has a strong affinity for those acid hit or pH, low pH areas as well. So not only that, but because nanohydroxyapatite is essentially calcium, phosphate, oxygen, and hydrogen, it's going to act as a supplement for calcium and phosphate. So you can think of it for those patients that don't have healthy saliva flow. It's going to be great for those kind of patients. And then the fourth thing it does is it helps with hypersensitivity. So provided it's in those nano-sized particles, it's going to be able to be small enough to occlude the dental tubules. So those are kind of the four things that it does in a nutshell.
Wow. And so I agree with you. There are more patients that are getting resistant to fluoride application. So how would you use the product? How would you apply it, and what would you tell your patients to do?
Yeah. So what's great about nanohydroxyapatite, it works best in a toothpaste. And so if you're using it in the proper concentrations, which are 10%. So there are clinical studies. There's one study in particular that examined 1%, 5%, 10% and 15% nano-hydroxyapatite to just look at what the remineralization levels would be at those different concentrations. And what they found was that at 15%, there's actually a plateauing. So between 10 and 15%, there's really not much of a difference. But once you reduce that down to 5% and then even lower to 1%, there is a dramatic difference in the amount of remineralization that occurs. So at 10%, there are other clinical studies that show that it is as effective, if not more effective, at remineralizing teeth than a 1,450 parts per million fluoride, which is over-the-counter levels of fluoride, slightly on the high end of over-the-counter levels of fluoride. So provided it's in those concentrations, and that was one study, but the real kind of nail in the coffin, I like to say, for looking at concentrations and settling on 10% as what needs to be the adequate amount, the optimal amount rather, is a systematic review. It was published in 2022. It mapped the literature that's currently out there. 28 different clinical studies were examined to look at nano-hydroxyapatite as a remineralizing agent. And what they discovered was that it does remineralize. It does provide hypersensitivity relief. It does provide whitening, and it does all of those things. It said when the optimal concentration is at 10%. So we know, as and your students will know if they're seniors in public health, that the systematic review studies, those are the gold standard. That is what we make policy decisions off of. That's what we make protocols and health based off of. So that's really the marching orders for us as hygienists, as clinicians, when we're recommending a toothpaste, that it is at that 10%. And not only that, but it has to be in the nanoparticle size. There's a real difference between the nano and the microparticles. The microparticles, or the hydroxyapatite crystals, those are kind of synonymous. Those are 1,000 times larger than a nanoparticle. So what that means is it's going to affect its mechanism of action. A nanoparticle is going to be able to infuse much deeper into the enamel rods and into those subsurface lesions. So it's going to actually remineralize incipient carious lesions, whereas a microhydroxyapatite or a hydroxyapatite crystal, it's going to stay on the top surface. Likewise, with hypersensitivity, a microhydroxyapatite crystal is too large to actually enter into the dental tubules. So it doesn't do anything to reduce hypersensitivity. On top of that, you would have to ask a toothpaste company that is using a microhydroxyapatite what their relative dental abrasivity is as well, because there could be a higher abrasiveness with a microhydroxyapatite crystal. It's just a larger crystal. With a nanoparticle, you can really get really, really low. The company that I work for has a relative dental abrasivity of 44, so extremely low. And part of that is because of its nanoparticles. And it's tricky. You have to look, you really have to do some sleuthing, because there are some companies out there that are putting in combined combinations of nano and microhydroxyapatite, and they're saying together we have 15%. Okay, well, if you've got 10% microhydroxyapatite and 5% nanohydroxyapatite, that's not quite cutting it in terms of providing optimal caries protection. Likewise, you have other companies that are putting in or reduced or diluted concentrations, and they're talking about a starter liquid solution. So that's another thing to keep an eye out for, is are companies that are masking what their final concentrations are and confusing consumers and clinicians by talking more about their starter liquid solution. So really, we want to be focusing, because the research focuses on what the final concentration is. So
yeah, that can be tough for clinicians and for patients, for sure. That's really good advice, Adam.
I know we're really at this stage, because nano-hydroxyapatite is not regulated by the FDA. It is regulated in Japan, but in our country, it is not viewed as like a medical ingredient like fluoride is. So with fluoride, you've got all types of constraints on toothpaste manufacturers. They have to list the type and concentration that they're using. With nano-hydroxyapatite, if it's a fluoride-free product, it's under the umbrella of cosmetics, and so there are no real parameters around what is clinically effective. So we fortunately though that we do have 20 years of research to look at, and PubMed is a great resource for that, at least to start with.
Yeah. Is just as a comparison, since you brought up fluoride and fluoridated toothpaste, is the cost comparison? I mean, the efficacy is obviously there if you're using the nano, but is it a cost issue that's making some of these companies, have less nano hydroxyapatite in their product?
That's a great question. I think so. That's my thought anyway. It's 5 times the cost of fluoride, and you need it in high concentrations in order for it to be effective. And so I think there is a real, especially if you are, I hate to say it, you're a corporation, you're beholden to your shareholders, or if you're a venture capital company, there are other incentives at play, and it is something to take into consideration. Nano-hydroxyapatite is much more expensive, so
Okay.
yeah,
I
that
was just
could be a
curious.
component of.
That's a barrier. Yeah, that's a barrier for some patients for sure, I'm sure.
Well, and as a clinician, I can say that when I come in with the science and I'm the one that's recommending it, and they're
Yeah.
coming to me with their problems of hypersensitivity, they're frustrated because they just got yet another cavity, and I'm there with the answer as the trusted clinician. It's been my experience that it has not been a huge hurdle. It's a lot cheaper than filling a
Yeah.
cavity. And if they've got hypersensitivity, a lot of times they're willing to try a lot of different
Yeah.
therapies.
It's all about bringing them up the learning ladder, right? And increasing your patient's knowledge, which you seem to do just naturally, Adam. That's awesome.
It's fun.
I know you also wanted to talk about silk floss. I'm really interested to hear your opinions on that.
Yeah, so silk floss, there's kind of a dirty little secret about floss. A lot of it is made of plastic. 95% of it is plastic. And when we're flossing, as maybe you've experienced and you've got tight contacts or uneven restorations or margins, it can shred. And for those patients that bleed when they floss, there is a thin layer between the epithelial cells and the bloodstream. And so that can enter the bloodstream. We can ingest it. It can enter into the lungs. It's kind of a depressing thought, but really the only bit about how much plastic is actually already in our bodies. But the really only efficacious or biocompatible solution is a silk floss. And so I recommend using a silk floss. Dr. Jen's, the company I work for, they make a 100% silk floss using coated with nano-hydroxyapatite. I also would love to, if I can share a little bit about the synergistic effects of nano-hydroxyapatite and fluoride before I forget. Do I have time?
Absolutely. You
Okay,
have the
thanks.
floor.
Awesome, thanks. Yeah, so this is super exciting. So there are studies, there's research out there that shows that when you combine nano-hydroxyapatite with fluoride, you get synergy. Now, the reason for that is fluoride, in order for it to provide optimal remineralization, it needs calcium and phosphate. It gets that from the saliva. So if our patients are lacking saliva, and there's over 400 medications that cause xerostomia. Sleep apnea is on the rise. Chronic obesity. There's a lot of people that are lacking saliva. So this is a population that we need to be asking ourselves the question, is a high prescription fluoride toothpaste really the option when it's not providing added supplement of calcium and phosphate? And so I think you see where I'm going with this. A nano-hydroxyapatite is that supplement. And so when you add the calcium and phosphate from the nano-hydroxyapatite plus the remineralization capabilities, plus the fluorapatite crystal, which is more dense, it reduces the critical pH down to 4.5. You really get a combined level of protection And Dr. Jens also adds in xylitol. They put in 14% xylitol, which, you guys know about xylitol. It's really the hero in the dental field. It's such an amazing ingredient. Bacteria, they love it. They are attracted to it, but they can't metabolize it, so they don't excrete acid into the mouth. So you get reduced amount of acid in the mouth. You get increased pH. You get increased saliva flow. So a lot of different benefits with xylitol. But those three together really are a really powerful combination. And Dr. Jen, she did there weren't any other toothpastes that were using these kind of ratios when she came out with the toothpaste. And so in December of last year, she hired a third-party lab to do an independent study on the what's called the super paste, which combines the fluoride, the nano-hydroxyapatite at 10%. So it's fluoride at 1,000 parts per million, so very low over-the-counter levels, and then 14% fluoride. And she tested it in a simulated xerostomia environment, so kind of the worst of the worst conditions, in a 7-day pH cycle where she's applying the toothpaste twice a day, 2 times a day for 7 days in an alkaline solution and an acid solution, just kind of mimicking what the body does, what the mouth does over the course of a day. And after those 7 days, they found that it remineralized 6 times more effectively than the toothpaste they tested it against, which was Prevenant 5000. So 5,000 parts per million fluoride. So this is significant for us as clinicians, as we recommend toothpaste to our patients that have high caries. I know when I was in school, there's just kind of an equation you do. If a patient has high caries, you give them high prescription fluoride toothpaste. And that is changing. And it's changing because we have what's in the US, a new technology. And then it's that synergy between the nano-hydroxyapatite and the fluoride, which is just so cool.
Wow, Adam, that is fantastic. To be honest with you, thinking about the patient pool that usually you really need to treat for that high caries risk is typically our xerostomia patients. And so to connect those dots and to really add in, that beautiful dance between the fluoride, the nano-hydroxyapatite, and the xylitol all together, that's incredible. I love that.
Yes, I love the way you put it, as a beautiful dance. I'm going to start using that. That's great. And for those patients exactly that are medically compromised, or just patients that don't have an appetite for fluoride as much, they're just not that excited about having that much fluoride. And for patients that are younger, for our children, if you've read the warning labels on a tube of Prevenant or Clinpro, it says on the warning label that if your age is 6 to 16, that you need to spit after you rinse, that you need to rinse thoroughly after you use the toothpaste. Well, that's counterintuitive to how fluoride works. That's why we have fluoride varnish. That's why we have fluoride trays. We want that fluoride to stay on the teeth. So with Dr. Jen's super paste, you can leave the toothpaste. It's recommended to leave the toothpaste on the teeth for at least 30 minutes after you use it. Spit, don't rinse. And then you can use it twice a day. And that's the other component to it that's great, is you can be totally comfortable using it twice a day. So you're getting a lot more benefit in that regard as well.
Wow, that is fabulous. No wonder it's called super paste.
Super paste. That's
Super
right.
paste. I love that. Well, Adam, this is like a remarkable helpisode for our students. I absolutely love the information you're sharing, and I can tell that you're excited about what you're doing. You're kind of combining all of your skills that you've learned over the course of your lifetime, and now we get to have you in the field of dental hygiene to really move the needle.
It is pretty fun. I gotta say, I feel like dental hygiene is such a good fit for me. I love being a clinician as well, and I do feel like it is just this amalgamation of the things that I've done in my life, and here I am,
Yeah,
doing what I'm doing. Yeah,
it's
so
great. So
yeah.
what is one thing on your journey that that you would want to share with the students? Maybe something that surprised you when you got out into the field, or something you've learned along the way as a nugget of advice?
Okay, thanks. Yeah, that's a great question. I think one thing I want to share with students, and this is something that I had to learn the hard way, was it was my senior year of dental hygiene school, and I don't know about in your program, Billy, but in my program, that is the hardest semester. There's just kind of a broad consensus. There's just so much being thrown at you. And I was starting to really get lethargic with school, and it was really starting to drain on me. And then I just had this epiphany one day, and I don't know where it came from, but I switched my language of I have to go to school, I have to do this project, to I get to.
Oh,
And when I changed that mindset, that changed everything for me. It became a blessing. It became a joy to go to school. And I've taken that into my private practice as well, that I get to treat patients. I get to clean people's teeth. And really that it does make all the difference. Um, yeah, so that's kind of just enjoy what you're doing. Stay curious. I heard it a lot when I was in school, but it's totally true that there is so much to learn in the field of dentistry and the field of overall health. And as you get patients, you'll get questions, and look those questions up. Stay curious. We've got amazing resources. You've got amazing professors. You can ask them even after you are done with school, and join a community of dental hygienists. All of these things can help you along your way, and just acquiring more information and just becoming just a lifelong student, really, because it's fun.
oh, that's so great.
Yeah.
You have an attitude of gratitude, right? As they call that.
You got to. Yeah, you really have to. I feel like it's otherwise it weighs you down.
That's
Yeah, focus
absolutely
on the
true.
positive.
That's
Yeah.
great. Well, that's, I think, a great place to end, Adam. Thank you so much for being on the podcast.
Well, thanks so much for having me. I really appreciate it. It's a real joy to be able to share with the students. And I just, yeah, if you guys have any other questions, feel free to reach out. You can just go to drjennatural.com, and I'm part of that team. I'm an educator there. And so if you've got any questions, reach out to us. You can reach out through that, or just my email address too. I don't know if you want to put it in the show notes or whatever, but I'm happy to talk with anybody and provide a resource.
Thank you so much, Adam. And I tell students all the time to network early and often. And so you'll be a great resource for them to reach out. And you have a very welcoming demeanor. Answer any questions, I'm sure, for them. Thank you so much.
Awesome. Thanks, Billy.
Okay.
Thanks for having me.
I would invite you to send me any questions that you need answered. Questions come up when you listen to this podcast. I have a link in the show notes, and I'd be happy to answer any questions that you have. Also, I would appreciate a review if you have time to leave one. Thank you so much. Hey, are you in dental hygiene school, or just got your acceptance letter and just started dental hygiene school, and you're worried about how you're going to fit it all in, what the evaluations are like, what the key strategies you need to set up in order to be successful? You don't want to have worked all this time to get accepted into dental hygiene school only to make some pretty major errors in your first and second semester. I've put together a course that will really help you set yourself straight right out of the gate and get yourself started on the right foot in dental hygiene school. Whether or not you're just entering school or you've done your prerequisites and you're just well on your way halfway through, this course is designed to help get you straight and keep you straight so that you can become a dental hygienist. Click the link in the show notes and check it out.